I'd like to ask for your permission to use this testimonial for educational purpose and on the internet.
Okay, sure.
So
yes.
tell me about your symptoms before the surgery first.
I had a lot of aching across my backside,
Yeah.
and just simple things like doing the dishes if I did, or made supper, or anything like that. I could hardly wait to sit down.
How long did you have that pain?
Probably a year, maybe.
Yeah.
Yeah.
You had a spinal fusion.
I did, and that
When
was
was that?
great.
When
That
was-
was great, and that fixed me pretty darn good.
Okay. That spinal fusion you got, do you remember when it was?
It was in August of, it was 2 years ago, I think.
2 years ago.
Yeah.
So that pain was gone, but then a year or so later you
Then the
notice you
other-
have a new pain.
Yeah, it probably was there all the time, but I just didn't pay much attention to it. After
Yeah.
the spinal surgery, I felt so much better because I was
Yeah.
so bent over and so crooked.
Yeah.
And I'm not. That was when my granddaughter came into the house the day I came home, and she says, "Grandma, you look like you've grown."
And because you're not bent, you
Right,
are
I was,
taller.
yeah, I'm a little bit yet, but
Yeah.
it's nothing like it was, not at all.
Yeah, and but we know that people who have spine problem, almost 43% of them, if they have again spine problem, that's mostly not spine, it's sacroiliac joint. We injected that, it temporarily got better after the injection,
Yes,
right?
yes.
How many injections did we do?
I had 3.
Yeah, that's a typical protocol.
Yeah.
Once we noticed that's a problem, about 9 months ago, we fixed the left side.
Yes. Yes.
So tell me, how did that go?
That went real well. The recovery was great. I didn't have any problems, nothing.
Did you stay in the hospital or did you go home
No,
same
I went
day?
home same day.
And then we asked you for a month not to step on it.
Yes, and
So-
I used the walker for a month, and in my home I have it so I can grab this and grab
Yeah,
that, and I
yeah,
didn't
yeah.
have a hard time with it at
Yeah,
all.
yeah. Well, that pain that you had going across in the sacroiliac joint, how long did that take to go away?
After the surgery, I didn't feel it much on that side at all.
Yeah,
You know, and
but
now
you have
I
some on the other side.
Yeah, I do now on the other side. So
Well, we know that half of the people, when we fix on the other side, one side, this is almost always a problem on both sides because you have two joints,
Right.
they age at the same time. But we know that half of the people that we fix one side, they can use it more. The other side get better by its own, but half of the people, we have to go there and fix the other side.
Yep.
In your case, I think we are not quite there to decide on the other side.
yeah,
You have
not
some
quite,
symptoms.
but I think it's coming.
Yeah, but for now we will just watch it,
Yes,
and I see you in
yes.
6 months. And obviously, if pain is getting worse, come
We'll do
back.
it. Yep.
Now that's something I was telling you off record, and I like to, for many of my patients as well, know that once we fix one side, obviously people are going to use it more. Especially they are going to use it more if the other side as well is a problem. Like in your case, we fixed the left side. If the right side causing problem, you're going to use more the side that we fixed for you.
Right.
And sometimes
believe
people
that, yeah.
overuse that,
Yeah.
and then pain get worse on both sides. Sometimes I used to wait a long time before I go and do the other side. What I have learned in the last few years that if pain goes back and forth, if the other side doesn't get better, if people start having even pain same side, sometimes waiting too long is not the best option
Yeah.
because then you start catching up with the problem. But you know, in your case, I think we are on a very good path to just watch it for now.
Good. I'm glad.
Any question or comment?
Nope.
Well,
No.
thank you so much for the interview. I really
welcome.
appreciate that.
Yeah.
Okay. So